Hello and welcome to You Can't Handle the Tooth. This is Dr. Griffin, Dr. J, right back here with you with another episode. I can't express my gratitude enough. I appreciate all of the feedback I've been getting. Last week, I took last week off. I was out of town. But the last episode we did 2 weeks ago had like 1,600 views. And we've literally had tens of thousands of views on these things. So as long as I feel like you guys are digging it, I'm going to keep doing it. All right. So today, what are we going to talk about today? I thought we would talk about a subject you might not think would be covered by a dentist, and it's called sleep apnea. So sleep apnea. Why is a dentist talking about sleep apnea? It's true. Most dentists don't have a lot of training in the treatment of sleep apnea. However, there are some dentists, a bunch of birds. Oh, by the way, I didn't introduce Katie. Katie's helping today. Say hi, Katie.
Hello.
And there are some dentists, though, that have had some continuing education and advanced training in the treatment of sleep apnea, and I'll get to why in just a minute. So, first of all, why is sleep apnea so important? What's the big deal? Right? What's the big deal with sleep apnea? So I've got a list of about 6 or 7 statistics. I didn't want to miss any because I think they're all important. So I wrote them down. And the first one is 80% of all ADD and ADHD are associated with sleep orders. Okay, these have all come from peer-reviewed journals, these statistics. You have a 10-fold increase in carotid atherosclerosis if you have sleep apnea. 10-fold. You are 3 times more likely to have some sort of heart disease. You are 4 times more likely to have a stroke. 25 to 33 increase in mortality if it's not treated. Snorers are 3 times as likely to be in automobile accidents. And the wives, I say wives because it is a little more prevalent in men, although women have it, but the wives or the spouses of people with sleep apnea lose 15% of sleep. And lastly, 38,000 deaths occur annually in the United States from health-related issues associated with sleep apnea. Okay, so those are the statistics. That's why it's so important, is it affects so many people. I mean, all of us, we don't have a direct family member that has one of those CPAP machines. We know someone that has, or we've seen some commercial or something. All of us are familiar with it. So what's the big deal? Now you know. You're at high risk of having some systemic problems if you are sleep apneic and have not been treated for it. Okay, so the one of the questions, there's a few questions that we've gotten about this. So what's the first one?
What types of sleep apnea are there?
So there are 3 basic types of sleep apnea, and this is important as it relates to a dentist. So there's obstructive sleep apnea, central sleep apnea, and then a mix, a combination of those. Obstructive sleep apnea is exactly what it sounds like. It is something occluding the airway, something that is physically impeding air from going down your throat, okay? And that could be, tonsils. It could be your tongue. It could be cellulite. It could be lots of things down there in the neck. So that's obstructive apnea. Something is obstructing the oxygen. The other one is central apnea, and that is where the central nervous system just doesn't tell the lungs to breathe. And so you just stop breathing. Sleep apnea, by the way, I didn't tell you the definition. It is the absence or the lack of oxygen that you get while you're sleeping, that the brain gets, okay? So it's being impeded somehow, and it's either your central nervous system, or it's an obstruction, or it's a combination of both. So if it's a central nervous system, the dentist really can't do anything for you. You have to see a pulmonologist or a cardiologist, someone that manages that for you in a different way. If it is obstructive, then you start to come in the world like maybe a dentist could help me. And why would a dentist help me? You can go to a pulmonologist and you can get a CPAP machine. Well, it's because everyone hates their CPAP. There's a website out there called I Hate My CPAP. No one likes them. They're loud. They're uncomfortable to sleep in. They have big masks and they can cause sores on your face. They're hard to travel with. So for all kinds of reasons, the traditional way to treat sleep apnea is with this CPAP machine, which is a machine that you wear that pushes air basically down your trachea while you're sleeping to make sure you're getting enough oxygen. And most people, more than 50% of the people that have sleep apnea who have a CPAP admit that they don't wear it, and those that who do admit that they wear it, it's a small fraction of them that wear it every night. They only wear it several times a week. Okay, so where does the dentist come in on this? If it's obstructive apnea, within that world of obstructive sleep apnea, there are 3 types: mild, moderate, severe. And those are based on how little oxygen you get, okay, and how many episodes you get, like per minute, that you're without oxygen while you're sleeping. So if you fall in the category of mild to moderate, there was a study that came out in the Journal of Sleep in 2006 that kind of turned the page on this and said that if you have mild to moderate sleep apnea, a dental appliance can help with that. And so a lot of people are turning off their CPAPs and they're getting these dental appliances. If you have severe, it's really not a lot. I mean, it can help. In fact, some people that have it severe have to use a dental appliance and the CPAP. Okay? So the way this dental appliance, we'll get to the treatments. I'm going to get to those in just a minute. So we've done that. We've done classifications, signs. So how about that? What are the signs of sleep apnea? How would you know if you think you might have it? So one is snoring. You'd be surprised, but if you snore, that sound is something stopping oxygen from freely flowing down the trachea. If you have excessive daytime sleepiness, if you awake at night suddenly gasping or choking for air, those are all symptoms. And there are many more. Headaches. Some that I don't want to talk about. Decreased sex drive. I mean, there are lots of symptoms and signs associated with sleep apnea. And so if you can look those up. If you have any of those, maybe you want to get seen and get a test done, a sleep study done to see if you actually have sleep apnea. So the next thing, prevalence, like how many people have them. How often do you see it? It's about between 1% and 4% of all of the population have sleep apnea. It's 5 to 10 times, 5 to 10% more common in males. And as we age and as we gain weight, it becomes worse. It worsens with age and with weight, although those aren't necessary. All right, treatment?
Treatment.
So how about treatment? So you can have the CPAP machine or you can use the dental device, which is what this is about. We're talking about how this helps. So usually what happens is patients will sleep on their back, and while they're asleep, their chin falls back and the tongue falls against the pharynx, and that closes off the trachea, or closes the circumference of the pipe, and the air, there's less room for an air. If you think of it like a garden hose, that's the best way that I can describe it. So a little pinch in the garden hose versus, bending it all the way and squeezing it tight, anywhere in between there. So that's what happens with the trachea, and the air, the amount of air that gets in, or oxygen that gets in, is decreased. So where a dental device comes in is it helps keep the jaw in a forward position, opening up the trachea, allowing air to go in and out. And there are many different devices. If you look this up, dental device for sleep apnea, you're going to see 25 different kinds, maybe more. So this is a very common one, and I don't know if you can zoom in on this at all. Do I need to come closer? Is that good?
No, you're good.
So this is the lower has these little fins on it, and the upper, this is just a little mouthpiece you'll wear, kind of like a night guard. And this upper part right here, we can move this forward and backwards. But as you can see, this lower jaw, because of the fins, are preventing it from going back too far. So with it out, see, the patient lays back and falls asleep. Get my face out of the way. And the chin drops back like this, closing off the trachea, the tongue down here and stuff. But with this little border here and the fins on the lower mouthpiece, the farthest that this can go back is right here. And these things actually you can adjust for every person. So I can make it so the farthest they can go back is here, or they can go back a little bit further. It's totally adjustable. But I can't emphasize to you enough, if you're a snorer and you get a snore guard, you could be not treating yourself for sleep apnea. So you may want to look into that. These devices will help you sleep better, and they will help keep the airway open. Trying to think if there was anything else I wanted to say about these devices. I know there's probably going to be a bunch of questions that come in on this one because it's not so dental related, and we'll get to them as they come in. But it's important that you have a sleep study done, that it's managed properly. You can't go into the dental office and go, hey, I think I have sleep apnea, can I get one of those devices? You need to see a pulmonologist, your general physician. They'll get a sleep study done. Once you get diagnosed with sleep apnea, then we can talk about treatments. And one of those treatments would be the CPAP, which is the gold standard. And then those patients that either can't tolerate it or don't want it, if you qualify in the mild to moderate range and your physician says, yeah, I think a dental appliance would do for you, then you can get referred to a dentist. You can Google sleep dentists or dentists that treat sleep apnea, and you can find somebody that does that. Cost. Everyone wants to know about cost stuff, and I always forget that. So these devices will range anywhere. I've seen them as low as $2,800, $2,900, and I've seen them as much as $6,000 or $8,000. Most of the time, there is a medical coverage for it, and depending on your insurance, I've seen them pay 100%, and I've seen them pay. I've never seen one pay less than about $1,200. But when you think, man, it could be $4,000, your insurance is paying $1,200. There may be $3,000 out of pocket for it. But the benefit is no more CPAP. That's the benefit. So if you have questions, please send them out here to Facebook or hit us up on Snapchat or Instagram. I had comments yesterday from a guy in the UK. Believe it or not, they came through Snapchat. So we do these consults all over the world. Happy to share information and content with you guys, so don't hesitate. That's it. So thanks again for joining us with You Can't Handle the Tooth. This is Dr. J signing off. We'll see you next week.